Hi everyone, welcome back to today's learning. It is nice to see you again. Today we will be talking about neoplasia. They are uncontrolled growth of cells. Well, let's get started.
Cancer is the second leading cause of death in the US after cardiovascular disease, and the number 3 cause of death in Indonesia after heart and stroke. Cancer can affect any age group, any organ, male or female. Most commonly affects men on the prostate and women on the breast. Cancer is the result of abnormal cell differentiations and growth. Cancer cell growth is uncoordinated and autonomous. The cancer mortality profile in Indonesia shows the difference in the number of cases for each type of cancer. Death from cancer in men is higher. WHO data in 2014 showed that cancer mortality in men was due to cancer of the trachea, bronchi, and lungs, while in women due to breast cancer. There is some terminology that needs to be understood. Neoplasia comes from the words neo or new and plasia or form. Neoplasia is a new growth process. Neoplasm, there is a new growth from itself. It can be benign or malignant. Tumor means swelling. Historically, all swelling were called tumors. Today, tumors is a synonym for neoplasia. Oncology comes from the word onkos, which means mass, and logos, which means reason, the study of neoplasia. Oncogenesis, genesis means productions, neoplastic productions. Cancer or CREB, a general term for malignant neoplasms, and is more widely used for humans. Called cancer because it has similarities with crabs, sticking using the ordinate like a crab. Infiltrates with erosive growth. There are inconsistency in classifications and nomenclature. The suffix "oma" is almost always used from the word "oncoma", meaning swelling. Naming indicates benign or malignant. Mesenchymal or epithelial. Mixed tumors contain more than one cell type but originate from one germ layer. Classifications and nomenclature of neoplasm. There are benign and malignant tumors. Benign mesenchymal tumors are structural tissues, blood vessels, and lymphatics, such as lipomas, fibromas, and osteomas. Benign tumors of epithelial tissues, hepatocellular adenoma, mesenchymal malignant tumors such as liposarcoma and osteosarcoma. An example of inconsistency in tumor nomenclature, for example, melanoma in malignant tumor melanocytes. Most benign tumors contain nearly normal, well-differentiated cells, often with a similarly normal architectural arrangement. Benign tumor growth is localized at the site of origin. It grows and enlarges slowly and has a fibrous capsules. No metastasis. Some benign tumors can shrink on their own. There are types of benign tumors that can develop into malignant. Some can cause death due to filling a narrow place such as a brain tumor. Or fatal cases, such as tumor in the glands that produce hormones, such as pancreatic tumors that produce insulin, causing hypoglycemia. Malignant tumors are aggressive and life-threatening, characterized by the nature of anaplasia or loss of differentiations, rapid growth, invasiveness of the surrounding tissues, and metastasis.
There are 4 routes of spread of malignant tumors. The first one is through local invasion. The second one is through lymphatic vessel, and the third one is through blood vessel, and the fourth one is transcoelomic spread.
There are 5 carcinogenic agents, namely chemical carcinogens, viral oncogenes, radiation carcinogens, chronic inflammation, and heredity. The stages of carcinogenesis consist of several stages, namely initiations, promotions, and progression. Initiation is sufficient exposure to a carcinogenic agent. Promotion is the induction of uncontrolled rapid growth. And progression is the process of tumor cells undergoing phenotypic changes so that they are able to invade, metastasize, and grow uncontrollably. The presence of neoplasms can cause changes in functions leading to pathological directions. A tumor can cause pressure on the surrounding area. Tumors can cause bleeding, blockage, and tearing of the ducts. Tumors can cause ulcers, necrosis, and infections. The presence of a tumor can cause effusions in the body cavity. Tumors can trigger pain, cachexia, anemia, inappropriate hormone productions, and paraneoplastic syndromes.
Okay class, the lesson is over. Thank you and goodbye. See you next week.